So I bet you are wondering, is there anything I can do to help with that urinary frequency we've been talking about? Because I am one of those women going more often than every 3 to 4 hours. Here's your answer. If you are one of those people, what you can try is when you get the urge to urinate, you've just gone to the bathroom 30 minutes before or an hour before, and you know your bladder is not full, but it's simply your mind and bladder on the wrong track. What you should do first is number 1, stop wherever you are. Our initial response is always to go and run to the bathroom, which is about the worst thing we can do. Just think, if you're walking across the room with a full glass of water and try to run, it's going to overflow and spill. Same thing works with your bladder. If you run across the room trying to get to the bathroom with a bladder full of urine, you're likely to overflow or leak. The best thing you can do is stop where you are. Secondly, take a few deep breaths. And this would be the only time where I would recommend this third step, which is try to do Kegel exercises. Trying to squeeze or pull in those vaginal muscles has been shown in research to help relax bladder spasms. In these situations, I will often recommend clients to perform 5 to 10 Kegels, then try again to slowly walk to the bathroom. You can try to stop again and perform the Kegel exercises if you feel the urge is becoming stronger as you try to get there, and you feel as if you might leak beforehand. When you do finally get to the bathroom, some people then make the mistake of starting to bounce around trying to get their jeans or pants unbuttoned and sit down on the toilet. It is here that they will actually start to leak. That is again the bouncing of the full glass of water as you try to walk across the floor. So when you get to the bathroom, think slowly. Slowly unbutton your pants. Slowly sit down on the toilet to avoid any sort of overflow or leaking from occurring. I have patients that have had a lot of success with this technique, but it takes time. So I will tell them to start practicing it at home or in an environment not at work so that they are not initially peeing their pants on the way to the bathroom and cursing my name. It is not an easy thing to do, and when you start trying to do it, you will realize that. The reason is that it goes against everything we want to do. When you feel like you have to pee, when you are afraid you're going to leak, everything seems like you need to go fast. This is asking you to do the exact opposite. Slow down, take some deep breaths, and try to make it to the bathroom while going slowly and hoping that that will avoid the peeing issues. So now you might be wondering, what's the solution if I'm a nighttime peer? A great way to get rid of nighttime urination is to do a few exercises before you go to bed. Part of the problem with nighttime urination is that not only do we get into the habit of getting up and just in case peeing, but the other part is that once we lay down at night, all of the other actions of our body have stopped from during the day. Fluid that has accumulated in our legs and tissues through the day will then start to slowly come back up into the kidneys and into the bladder to be processed. So 2 hours before bed, you should make sure you decrease your fluid intake. You can take your pills, medications, have a sip of water, but don't sit down with a full glass at this point. Following that, exercises that I recommend to my patients is that you lay down with your legs elevated above your heart and then perform ankle pumps back and forth for 20 repetitions. Ankle circles back and forth for 20 repetitions, and then bend and straighten your legs for 10 repetitions. You can then get up and carry on with your night. The thought process with this is that if you are doing this 2 hours before you go to bed, you are going to, with those exercises, move the fluid that is accumulated in your tissues during the day earlier, which may make you have to pee more frequently in the next 2 hours before bed, in hopes that once you lay down to go to bed, you have already eliminated much of that fluid and it will keep you from being woken up and having to go to the bathroom.